What's up, you guys? Welcome back to my channel. My name is Sam Kelly, and today I want to be talking to you guys about what is the best PCE for PA school. I feel like this is such a common question that comes from all pre-PAs at some point or another. I just want to say that there are so many options for PCE for PA school, which is your patient care experience. As long as it's hands-on, it counts as patient care experience. I'm going to pop up the CASPA definition of what PCE counts as for PA school. Of course, as always, because things vary so widely among PA school requirements, please check your program's website so that you can really know if they count what you do as PCE or not. So there's so many things, like I said, that you could do for PCE. Don't forget, these are just my opinions. There are so many great healthcare professions that count as great patient care experience, but today I'll be talking about 3 that I think are the best and most hands-on patient care experiences that you could possibly get for PA school. All right, let's get to it. All right, the first profession is a respiratory therapist. I know you guys are probably going to roll your eyes. I'm a little bit biased because I was a respiratory therapist before PA school, but I have to admit, I think it's one of the best and most hands-on patient care experiences that you could possibly get. All right, the training to become a respiratory therapist is a minimum 2-year associate's degree. With the 2-year associate's degree in just respiratory classes, you graduate with an Associates of Science in Respiratory Care and then are able to sit for your 2 boards. The other option to become a respiratory therapist is to do a 4-year bachelor's degree in respiratory care. That is what I did. I knew I wanted to get my bachelor's degree regardless of what my future profession was. So I started at a 4-year university, took 2 years of general education requirements. Then I transferred into the respiratory program at my 4-year university, and the last 2 years of undergrad for me were specialized respiratory courses. Those mimic the 2 years that it takes to get an associate's degree in respiratory care as well. So I took the same exact courses plus general education requirements to become a respiratory therapist. I sat for my CRT exam and I sat for my RRT exam, so I was then qualified to work as an RRT anywhere in the US. So I mentioned those 2 degrees because they kind of are different paths. You can get your associate's degree right out of high school, which is great. If you want to get into the workforce and start working as a respiratory therapist right away, you're more than welcome to do that. Then as you're working and making money, you can then work toward your bachelor's degree, which a lot of hospital systems allow you to get reimbursed for tuition. And then after you get your bachelor's degree in whatever you choose, you can then apply to PA school. So it really gives you 2 options. I got my bachelor's, took gap years, and worked as a respiratory therapist, or you can kind of do it the opposite way. What's great about this profession is that you are so hands-on with your patients. You work in a hospital setting with many patient populations, and you have a heavy focus on the cardiopulmonary system. You individually treat respiratory patients on their therapies, you administer medications, and you administer treatments. This is all done under physician orders or through respiratory-driven protocols, which I talked about in another video, which I will link above. You're also the main healthcare professional that manages the airway, and you also manage the ventilator for mechanical ventilation of your patients. So as a respiratory therapist, you get to do a lot. It's so hands-on, and it's a lot of autonomous work and critical thinking, which I think is perfect for PA school. I think it's prepared me great. The second profession that I think gives you the best hands-on patient care experience for PA school is a nurse. A lot of people talk about, if you're a nurse, why don't you just go to the NP profession? But I think nursing gives you great patient care experience to become a PA and gives you a different way of thinking that can make you such a good PA. So there's a couple different ways to go about being a nurse. So first we'll start with the LPN. So this is a licensed practical nurse. The only requirement to start LPN school is just to have a high school diploma. Usually LPN programs are about 12 months. It varies from state to state. After you take your national certifying exam, you can then work as an LPN. Even though having your BSN for some hospital systems tend to be more preferable, you have a variety of places you can work as an LPN, and it's still great experience. You can then, after you get your LPN, go back and get your bachelor's in whatever you choose, whether it's a bachelor's of nursing, a bachelor's in public health, and then you'll be eligible to apply to PA school. Next, we'll talk about your BSN, which is your Bachelor's of Science in Nursing. This is a very traditional path that if you know you're going to be a nurse in high school, you can apply to college and go to undergrad for your Bachelor's of Science in Nursing. This is a 4-year program, just like the respiratory program, where you have 2 years of general education requirements, and then the last 2 years are strictly nursing courses where you get all your clinical hours, and then after you graduate undergrad in those 4 years, you are able to sit for your national certifying exam. This is a great option if you want to get your bachelor's and a great job after undergrad for PCE all in one shot. Then you can start working, gaining PCE, and then apply to PA school. Then another option for nursing is your ABSN. This is your Accelerated Bachelor's of Science in Nursing. Ooh, mouthful. So basically, this is for people who already have obtained a bachelor's degree in a different field and then want to just go back and take the nursing coursework. So these accelerated nursing programs can vary from 12 to 18 months. After you finish this program, you can take your national certifying exam and then you can become an RN. I believe this is one of the most hands-on roles you can even be with the patient. So in the hospital, the nurse is the main point of communication between the patient and the provider or other healthcare professionals. If the patient needed a breathing treatment, the nurse was there bedside assessing their shortness of breath and then called me for help as a respiratory therapist. They have that line of communication that is so important. They are not only there to notice any and all changes in your patient, but they do a lot of care with the patients. So I'll pop up something here that really has a great description of what a nurse does and what the duties are. But just know that this is a great way to gain very hands-on patient care experience before PA school. Nursing is usually looked at very favorably for PA school. Yes, nursing gives you the perfect route to then go NP, but some nurses choose to do the PA route, which in turn will just make them better providers because they have the nursing model and nursing perspective from their previous education. If you're more interested in this path, I totally urge you to check out Kanan Brown. He has the ER forum here on YouTube, but then also is at Kanan Brown on Instagram if you prefer that method. He is starting PA school this fall, so definitely check him out if you have any more questions about the nursing to PA path. All right, and the third and final job that I am recommending is a paramedic. Paramedics are so hands-on with their patients, and that is why it'll be great experience for PA school. So the training to become a paramedic. There are options to get your Bachelor's of Science in Paramedicine or Emergency Medical Services. This is kind of like the nursing and respiratory care bachelor's approach. So you do 2 years of general education requirements, and then the latter 2 years is the specialized education in paramedicine. So like I said, for the other options, this is a great way if you know right out of high school you want to get your bachelor's and a degree in something that'll give you great PCE for PA school, or regardless, just a great job in general. So another way to become a paramedic is getting your EMTB certification. This obviously varies per program and if you want to do full-time or part-time, but it can take about 6 months to get this certification. You then take a test that lets you be licensed as an EMTB and work on the ambulance. Then you can apply to go into a paramedic program. You can either get a certificate in paramedic science, which consists of your didactic and clinical coursework, or you can get an associate's degree in paramedic science. But in order to do this route to become a paramedic, you need to have your EMTB prior. So these two programs roughly take about 2 years to complete. So to give you a better idea of what a paramedic is, they are the highest level of an EMT you can be. So not only do they perform basic EMT functions that an EMTB would do, but they also are trained in ACLS. This allows them to administer IV fluids, injections, and medications, and it allows them to perform advanced respiratory procedures like intubation while in the ambulance. They are the first line of defense once an ambulance gets to a patient on the way to the hospital. Not only do they have so much autonomy on the rig, they are doing so many advanced procedures in an emergency, which will not only give you great experience, but it'll allow you to gain great skills that will make you a better PA in the future. All right, guys, I hope you learned something about some of the jobs that I think would be the best patient care experience before PA school. Trust me, I know there's a lot of other jobs out there that require a lot less training and certifications, but I do believe that jobs that require certifications or degrees tend to be the best patient care experience and the most hands-on, and it's because you have that extra level of education. If you feel like these routes are not right for you, don't worry, there's plenty of other jobs out there that you could do to get great PCE for PA school. But I have to say, a respiratory therapist, a nurse, and a paramedic, I believe, are the best hands-on patient care experiences that you could get before PA school. I also believe admissions committees definitely look at these professions as rated very highly and looked upon favorably when applying to PA school. So this is definitely a way, if you feel like you're lacking in other areas, to definitely stand out as an applicant. Thank you so much for watching. As always, subscribe, like this video, turn on the bell so that you can be notified when I post. I post every Thursday at 5 p.m. Eastern Standard Time. And if you're looking for more pre-PA tips and tricks, there will be plenty more of that content coming soon. Leave a comment below with your suggestion of pre-PA things that you want me to share on here. As always, I will talk to you guys next video. See ya!